This is the Fight Strength Podcast.
All right, let's go.
Get the insight and perspective from two elite strength and conditioning coaches who work with the full spectrum of fighters from amateur to UFC champions.
That's it, JJ. Finish it.
We don't just talk about it.
Keep moving.
We are about it.
Don't stop. Let's roll.
We live this.
Come on, D.
You're listening to the Fight Strength Podcast with me, Phil Daru, and McGregor McNair.
Good job. That's how we roll.
All right, everybody, thank you so much for joining us again on the Fight Strength Podcast. This is episode number 45. Now, Phil and I have got a very special guest for you all today. This is Dr. Christiana Marron. She is, well, look, I'll let Christiana introduce herself. Please tell us a bit about yourself, how you got on this journey, and exactly what you're getting up to these days.
Well, thank you, Mac, and thank you, Phil. I really appreciate you having me on. I'm a doctor of physical therapy. I started off background in science and sports way back when. I actually played Pee Wee football until I was 8, if I go way back. And then, I know, right? Not typical girl. I always grew up around the guys. My brother, I always watched my brother box in the basement, so I was always around fighting, WWE stuff, and then the old school boxing. So I always was into fighting and sports and all that stuff. And then it was funny, it took a path. When I was 13, my best friend was diagnosed with lung cancer.
Oh, wow.
And I would take her around my teens, like 16, 17, and I would take her to physical therapy. That was part of her weekly routine as she was going through chemo and radiation. And it made me really happy to like see how much she would actually benefit from it, even if she was, feeling at her worst. It made her happy. And I was like, man, I really want a job like that. So I started really young, 16, 17, working as an aide in an office. I grew up in a small town in Goshen, New York. It's a little north of the city. And there was nothing much there. Everyone knew everyone. And so I started working in a clinic actually out in Mattituck, Long Island. And same thing, small clinic, smallest physical therapy clinic probably within 20 miles. But the guy I learned under, he's very smart, orthopedic setting, saw a lot of surgeries, post-surgical. And I was just cleaning tables at that point, but I was really observing a lot, and I was really taking a toll on it. And then my best friend passed away when I was 18. And that was my transition into high school, into college. Like, what am I going to do with my life? So I was like, I'm going to go and be a physical therapist. And at that time, I still kind of wanted to go around that route, helping patients that were going through chemo. And then I bounced back and forth with joining the Navy. And I didn't really know which way I wanted to go, to be honest with you. But again, I'm still really good with sports. So I was a long distance runner for years. And then I was amazing. I went and did Nike Nationals. I don't know how I was so good at it. Now I can't even run to the ice cream truck. But so I had a bad knee injury, and I started powerlifting. One of my buddies in college was like, why don't you start powerlifting? And I was like, I can't even lift a 45-pound bar. Like, how do you expect me to do like powerlifting? And it went from there. And he was a very straight edge friend of mine. He didn't drink, he didn't party in school. And he kind of got me on that path of really enjoying powerlifting, be in the gym every other day, squat, bench, deadlift. And then I started deciding to minor in personal training. So my major was biology and my minor was personal training. And I started learning a lot more. And I had a really great anatomy professor in a state school, which was surprising. But I knew so much about anatomy. We dissected a cat, and it just kind of went from there. And then I did my first powerlifting meet. And it just was kind of like, wow, I really love this. And when I moved back home, I actually didn't get into med school my first year that I applied. And the whole reason was because I didn't have a higher GRE score, which to me is baloney, because, that doesn't really dictate who you're going to be. Test scores on something like what a big word is in the English language isn't going to dictate how great of a trainer you're going to be or how great of a doctor you can end up being. So I retook the test. I didn't really do much better, but I ended up finding a school that actually didn't look at it as a doctorate prerequisite. And I got in, and it was a small school. and it was New York Institute of Technology, so it's in Old Westbury on Long Island. And at that time, someone got in my head about, maybe you have a great physique, why don't you start bodybuilding? And I was like, I'm not getting on stage and putting a bikini on and high heels. I'm not that type of girl. And it stuck into me because I've always been an athlete through college. You know, I always had some sort of million things, like Phil said, like he's up at 3 and he doesn't go to bed till 2 a.m. I was always like that. And I think that always made me really good at what it was I was doing in school. So I started on a track to bodybuild my first year in med school, which was crazy because all my friends were like, "You're nuts," you know.
It's a fair bit to take on.
Yeah, yeah. I didn't have too many friends after that, but no, you know, I would get up at 4 a.m. and it was funny. So someone told me, if you really want to get into the bodybuilding world, you have to train out of Bev Francis' gym in Syosset, which was literally right down the road from where my school was. Mm. So I started training there. I'd get up, I'd go there at 4 a.m. I would do an hour of cardio, I'd study. And then I started meeting a lot of people that went there, a lot of the professional athletes that went there. And someone had said to me, my coach at the time had said, you should get with Michael Camp. And he's absolutely tremendous, intelligent, knows his stuff. He works with professional athletes. Like, I really think you'll love it. So I went on a whim. I went to his office. I introduced myself. You know, not that he knew anyone about, like, anything about me. And I was like, look, I don't know if you're looking for an aide, or a volunteer. I'd love to observe. I'd love to be in your office. I'd love to learn from you. So Mike took me under his wing as an aide, and it was the best thing I could have ever done. Wow. Because I got to see him work with Chris Weidman, Ryan LaFleur, Dennis Bermudez, Dre the Bull, who else? I mean, everyone out of his office. And I actually really got my love back for, like, fighting. And he works with a lot of professional bodybuilders too. But working with a fighter and a bodybuilder was like two different things. Mm. You know, sometimes bodybuilders, you can tell them all the things they want to do. But when you have a fighter who's, you know, it's a little different. When you're working with a fighter, they have a lot more injuries going on than a bodybuilder. There's a lot more rotational aspects to a fighter than there is a bodybuilder. Bodybuilders, powerlifters, we're very sagittal. We're very one plane, and fighters are very rotational. They work in different planes. So I got to learn more working with fighters with Mike Camp than I had ever known. So I excelled in school working alongside him. He taught me more than I think school would ever teach anyone. And I was really grateful for that. And he opened up so many connections for me. He introduced me to Tony Ricci. I went to a lot of seminars that he held at Belmore Kickboxing with Keith Trimble. And I just kept getting into it and getting into it. And then between my second year, I was getting actually ready to transition from figure to physique. And I got diagnosed with type 2A breast cancer. And that took a toll on me because I was like, you know, everyone's like, well, maybe you should take a leave out of med school. You know, maybe you should stop training. You should get off all the stuff you're on. You know, everyone wanted to put their input.
Sorry, how old were you at this point?
I was 24.
Wow. So young.
Yeah. Yes, and it runs through my family. So my older sister actually had ovarian cancer a couple years before, and my grandmother had breast cancer, but she was very late stage when she got diagnosed. At that point, it went to her bone, but I still wanted to train. I was at a really low point, like I was, you know, pretty much broke. Didn't really have too many options at that point. I was working at Mike's. I was working as a personal trainer at a country club at that point. You know, I was working on getting my CSCS and just a lot of other things, and then finishing a year and a half of grad school. So my boyfriend at the time was like, you need to keep going. You need to not stop. Mm. You need to do the opposite of what everyone's telling you to do. And he pushed me to get up in the morning, to keep doing my cardio, to go to the gym, to make things like it was normal, to go take my tests, to just keep going. And I honestly think that if I didn't do that, I would have been way behind than where I am now. And it's funny because then I met Chris Algeri I watched Mike Camp get him ready for the Pacquiao fight, and I got to be a part of that, which was huge. And Chris actually pulled me aside when we were talking about stuff, and he's like, let me do your diet plan, you know, while you're going through chemo. And I was like, that would mean so much to me. And Chris is so intelligent in the nutrition world. So, you know, I had such a great team, and I still do. And I really think that doing that and doing the least amount I could in terms of drug wise for getting over this. I mean, I was early advanced. I was type 2A. So it was pretty early on, but I did 7 rounds and then I was clear of remission. And that was 3 months before I graduated.
Wow.
So at that point, my boyfriend and I decided to make the decision to get out of New York. And I was kind of fearful because I had such a big connection there. I had such a niche there. So I was like, if we go to Florida, I don't know. I don't know anyone down there. I don't know no one. I lose Mike. I lose all of those guys. So I did it. So I moved down to Florida. That was 2016. I graduated in May, moved down here. I started working in a company that was pretty interesting. I worked with addicts in recovery as a physical therapist.
Okay.
Which, to be honest with you, I took it because of money.
Right.
You know, I took it because I had to get on my feet. We came down here with less than $200 to figure it out. So I was like, look, that's the best setting I can get into right now. Some of the other outpatient settings, I was like, I really don't want to go back into that 4 or 5 patient setting where they rush you through. You can't look at someone, you can't evaluate them correctly. And so I was like, whatever, I'll take this job. And it taught me so much as a physician because it taught me, and it's funny because I've had professional athletes come through, you know, dealing with addiction. I've had neurophysicists come through. I've had very famous, popular people come through on my table that are dealing with addiction. And it runs rampant down here in Florida in terms of the recovery center. But I actually started learning pain science more. And I started learning about this biopsychosocial model. And I started learning about, and that's something that I'll talk about a little bit with you guys, that I actually do implement with a lot of my athletes. It's what have they gone through in their past, or what psychological issues are actually feeding into that injury. And it really grew me because those people are not easy to deal with. I mean, they're coming off a detox and you're like, oh, let me evaluate you. And now I was very up and ready. I wanted to work. I was so excited. I passed my boards. And they're like, F you, I'm not doing this. What do you mean? Physical what? Like, I'm not doing anything. So I was like, look, I need to get into my niche. I got to find my niche again. So I started doing more on social media. And then my boyfriend threw out at me. He goes, why don't you just make your own practice? I was like, I'm young. I just got out of school. He's like, you are so far advanced that you can do it. Like, you have such a big background. Go ahead.
What I said about this when I met you, Christiana, I said that, you know, just because you think that you may be young, the abilities that you have supersede your age, you know, and at the end of the day, if it's your time to make it happen, you have to make it happen. And if you wait too long, you may miss the boat, right? But people need to know you. They need to know what you do. And this is why you're on here, you know, what you've done with my fighters in this short span, and we'll get more into detail on that. But like I said, you got to stop thinking that you're not ready when you are ready. And if even if you, you know, even if you may not be totally 100% ready, you still need to make the effort to do what you want to do, because at the end of the day, like I said before, it's going to pass you by if you're not adequately making your steps in the right direction.
Right.
But keep going. I don't want to stop your fire.
That's okay. No, it's fine. That was my mindset, you know, and I gave him that same excuse. And my boyfriend's like, get a table, get your business license, let's figure it out. So I did a booth at the Fort Lauderdale Fit Expo, and I got certified in Graston, which I'll talk to you guys about. It's the use of metal instruments injuries. And I stood out in front. I was really nervous, but I'm intelligent. Like, I know how to talk. I know how to explain things. When I'm in the move doing my thing, I'm good. And my boyfriend's like, you got to get comfortable being uncomfortable. Like, you have to get out there. So I stood in front, and then all of a sudden I started having a line, because I was doing it for free. And next thing I knew, I was treating 64 people one day. I didn't stop. And then the next day on Sunday, I treated like 68. And then that day I had Dexter Jackson, who's a big time bodybuilder, walk by my table, and he was like, why is your line longer than mine? And I was like, come on, come try it out. And he posted me on his Instagram, and it just kind of took off from there. I made a lot of big connections down here in Fort Lauderdale. And that's how I started. I started working in and out of little gyms and, giving them overhead and just meeting more of the athletes. I started off more the bodybuilding, and then I found a connection in powerlifting, and that meant a lot to me. And the one thing I wanted to get and connect with was fighters, because I love working with fighters. And I love watching Mike, and I love watching all that he does. And I really wanted to hit that area because it's huge down here in Florida. The fighting community is huge down here. And it's funny. So Chris Algeri has a place down here, and he comes down every so often to train. So Chris reached out to me because he was dealing with an injury. And he's like, hey, can I come and see you? Because I tweaked something. I'm not able to go. I really need to see someone. He's like, and you're the only person I really trust down here. And I was like, me? I was taken back. I was so excited. I was like, oh my gosh, I'm going to go from being like Chris's like ball boy in Mike's office to actually treating him. And it was so awesome. I learned how smart I was actually doing it and working with him and making him realize how I had taken all that knowledge and I even surpassed it. And he was like, you need to meet the people down here. Like, your knowledge and the way you work with people and the way you figure things out and the way you assess things. He's like, you're so intelligent. You got to get out and you got to get your name out there. So Chris really started promoting me. And I think he talked to Dr. Peacock, right? Mm-hmm. And Phil and a couple other people in the fight science community. And I was probably 11:30, 12 o'clock at night. And I was like, you know what? I'm just going to message this guy. I'm going to message Phil, and I'm going to reach out to him, and I'm going to just go on a whim here, and let's see what happens. Let's see if he answers me. And he did, and I didn't know which way it would turn out, but I really wanted to be a part of the community. So
those of you that do know, I'm on my DMs. I'm always on my DMs. Everybody knows that. I answer almost everybody's question as much as I possibly can.
And very quick.
24 hours
not
a day.
To say that I'm not, not to say that I'm not working, but I make it a point to make sure that I have answered all my DMs, all my emails, because just like Christiana's trying to do, I'm trying to be the best that I can be and help as many people as possible. So coming across this young lady, knowing that she has the talent, has huge potential, I said, let's go ahead and give it a shot. And then we met that day, or the next day, I believe, or something like that, correct?
Yeah, it was that week or something like that.
Yeah, well, I'm so glad you did. I'm so glad to have you on the show today, Christiana. What an incredible journey you've been on so far. I mean, if you were to reflect back at the journey so far and all the things you've been through in your personal life and your professional life, does it feel like the timeline of things has really shrunk and you've had to do a whole lot of growing up really, really quickly?
Yes, it has. It has. I turned 28 last week, and I was like, here I am. I just opened up my own practice about a month ago, and here I am on the podcast with you guys, and it's like 2 years ago I was broke, and my boyfriend's making a wood table for us for our kitchen table. It's crazy.
I love that. I love that.
But with that being said, though, it didn't just happen.
No.
I mean, it happened, but you were making your gains throughout time. It wasn't like you just started this and boom, now you're on top or anything like that. You put in time and effort for years and years and years, and then now it's finally showing. So for people out there, I'm trying to say this in general, you know, if you think that you're just going to be overnight success and that things are just going to happen to you, boom, 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 it's not going to. You got to put your time in. You got to be consistent. You got to love the process.
Oh, yeah.
And that's what you do, you know. So let's get down to it, all right? Christiana, let's go over, you know, what we've been doing so far with my guys at ATT and what you've been doing as far as, you know, any type of things that you've seen from, you know, as far as injuries and dysfunctions that you've seen that's been correlating, you know, consistently with every fighter. What have you seen primarily?
So the primary thing that I see a lot is, you know, they're always in a fight stance here. So a lot of what those fighters end up dealing with is they have a lot of issues, and I'm going to start from the inside out. One, a lot of shoulder impingements, a lot of shoulder dislocations. And a lot of that, what you see on top of that, is their first 4 ribs tend to be really rotated or out of place. And so that affects their thoracic mobility, which the ribs attach and they wrap around to your thoracic spine. So they end up being more rounded and more kyphotic, and that tends to throw them off too. And now, obviously, we as a fighter, you always kind of sometimes you'll find a fighter that can do both, but you'll have a dominant side. So you see their rib cage actually rotated to that certain side, and you'll see a lot of them deal with oblique issues, or they'll complain of rib, you know, discomfort that came out of nowhere, not even from like a kick or a blow to the side. But you'll find these imbalances. And then if you go from the shoulder complex and you look at the ribs being rotated out and the shoulder issues, you'll find, let's say they're more forward on their right, they end up having more left hip issues. Because there's a fascial swing, the oblique fascial swing that comes around down. And it's funny because so many fighters will be like, oh, yeah, I have this right shoulder issue and I have a left hip or left knee issue. And I'm like, it makes sense. And I smile and they're like, why does that make sense? You know, and then I kind of have to take them through their own patterns again. And so that's one of the biggest things I see with them. I see a lot of hip impingements. That's a lot from their kicking. I see a lot of SI joint instability. So you're talking about the sacrum, and that can also be from their kicking, and that can be from their wrestling. So if they're not doing a lot of pelvic floor stability, those tend to come right out and they can slip, or it can be from a fall or a grappling accident, whatever. And I see a lot of elbow tendonitis.
That stems from the shoulder?
Yeah.
That stems from the shoulder.
Yeah. Wrist injuries
right?
too. Yeah, well, I mean, and that's something I'm going on with a couple of the fighters too, is that when we do a motion, we want it to be from the shoulder. But there comes a point where sometimes it gets too fatigued, right? And we want that rotator cuff to hold that shoulder stable. And they end up taking the blow through their elbow or their wrist. And that's when you end up finding those repetitive trauma issues. So when you're like, oh, you have golfer's elbow, they're like, I don't golf. I'm like, I know you don't golf, but you're placing that pressure through the inside of your elbow too. Yeah. Because this isn't holding on strong. And again, and I always go from a broader outlook for them. Again, and they're rotational, but fighters are rotational. So you're going to find that. They're not just asymmetrical injuries. So that's one of the biggest things I find with them.
So what are the mean? Sorry, Phil, I'll just get this one out quick. Okay. With the kyphotic nature of a lot of, especially the striking martial arts, what are some real basic things that people can do in their own time in terms of exercises to help balance things out a little bit in terms of internal and external rotation of the shoulder?
So I like to do with like an exercise program, if you do a basic one from the, like, again, thoracic cage out. So I have them do something as simple as like a side lying open book where they're on their side and they're opening up and they're rotating out. But instead of just them going through the motion, I'm having them focus on their breathing. Right. So if you focus on getting 360 degrees of rib mobility and diaphragmatic excursion, you're going to address this as well too. Some of those guys will just go through the motion and it's like, no, you gotta work on opening up that rib cage too. So I'll have them do work like that. I can have them do all fours, like quadruped rotation. Again, I love the rotational motions with them where they're on all fours and they're breathing in, inhaling, tucking in, and then they're exhaling, open out. And then I like something called the kibblers, which is something I actually took from Mike. And it's warming up the rotator cuff in not just your typical in and out motion, from the side or up at 90, because again, they don't do just this motion. Mm-hmm. Yeah. They're all over the place. Mm-hmm. So the kibblers, you can do it with like a weighted, ankle weight on your hands, or you can do it without. And some of them I have start without because they fatigue easily. And there's 3 different types of motions where you're actually taking them through patterns and you're working the scap on the thoracic cage to get good mobility, and then promoting the rotator cuff stability as well. Beautiful. So I'll throw those in. And that's, again, you're taking them through their whole mechanics that they need to pretty much do in every single move that they make. And then I throw in a lot of the cars. I don't know if Phil has talked to you guys about the FRC principles. So I like to
use we have a lot. We have.
So yes. So I like to throw those in. I really started using those a lot in rehab, and I was talking to Phil on the side about this because I'm actually seeing a really good benefit, especially even something with hip impingement. And usually with a hip impingement, you don't want to put the leg past 90. You don't want to keep irritating it. But I'm actually finding as you show the body from a neuro standpoint that the body can go through that range of motion and you can kind of clear it out yourself. I'm finding, decreased issues with shoulder impingement issues with fighters and hip impingement issues with them by taking them through that full range of motion.
As a clinician, you can do some soft tissue work and then have them work into their controlled articular rotations. I can't do that because I'm not trying to fuck them up and I'm not a clinician, but you can. You can. Yeah. And so that's what makes it better. And that's actually it's a blessing to have her around because I can have her do the soft tissue work and really work on the guys, and then I can go through my full mobility work, and then she gives me correctives and things like that, and we're kind of on the same page when it comes to that. Yep. So I'm happy that I have somebody there that I truly can utilize, and she's obviously smart, as you guys can tell.
Licensed to fuck people up.
Yes. In a good way, though.
Yeah, absolutely. Yeah, that's fantastic. No, there's so much value in the FRC cars. Like Phil took all the guys here in Australia who attended the seminars. I think there are a lot of minds blown. And we were talking specifically about teaching the body the new range, which you just touched on there, Christiana. And from memory, Phil, that has a lot to do with mechanoreceptors and finding new patterns. Is that related to what you're saying there, Christiana?
100%, because again, if they come into an issue where they're in a fight where they get, their arm blown back or pulled back in a direction that they've never been in or not introduced to, and all of a sudden they're introduced to it real quick with a force, I mean, obviously it's going to hurt.
Absolutely.
It's going to be an injury. So it actually prepares the body to say, hey, I've already been in that available range. Yeah. So you're decreasing the risk of that injury. And I tell a lot of people, look, I can't prevent an injury from happening, but I can prevent the risk of it.
Yeah. Yep.
Help you prevent the risk of it.
Yeah, which a lot of what we do as performance coaches is, risk management and stress management a lot of the time. So absolutely, I can identify with that.
Yeah, some of the other stuff I've been playing around with too, I don't know if you guys have heard of it, is it's called Postural Restoration Institute. And so they do a lot of work with rib mechanics and pelvic alignment and how that can affect your left shoulder if your left hip is out of place, and what you can do to do some sort of exercise with starting at the rib cage out, putting your body in different planes, opening up through breathing and decreasing the pain or injury from that too. Mm-hmm. And that's been kind of, mind-opening to me.
So I have a lot of guys, obviously, Christiana, but I'm going to say it for the listeners out there, with the jiu-jitsu guys that I train, and I'm talking primarily jiu-jitsu because they are fairly high kyphotic in nature with tight psoas, tight hip flexors, things like that. And I do see a flared rib cage there. Now, do I work more diaphragmatic breathing patterns? Do I work on intra-abdominal pressure? Or should I do something different to help negate that factor? Maybe even some soft tissue work on the psoas and then opening up with some extension through the posterior chain. What would you think?
Well, soft tissue work always has its point. And a lot of what I like to tell, because look, at the end of the day, people love to look at the soft tissue part, but the stuff I do on the table is not going to translate into a cage, right? So the soft tissue part is great, and that's where I do play, I do come in. But the breathing mechanics, and again, like restoring 360 degrees of diaphragmatic excursion for those fighters is going to help them get out of that kyphotic nature like you're talking about. That's going to decrease the tightness. Look, you can stretch a psoas till the cows come home, but what if actually what you need is actually retraining neurally of how the hip flexor moves, right? So if you're restoring that, and that's what I think a lot of people get caught up on. They're like, oh, well, they're kyphotic, so they definitely need to stretch their hip flexors. Well, you really want to take that athlete through a good assessment, and you want to see, well, are they really tight? Or do you actually need to strengthen that? Is that something you need to work on strengthening wise, and then working on, like you said, the rib mechanics, opening up that, and then maybe doing some retraining, neuro re-education of that psoas muscle.
So we're basically talking about mobility over flexibility in nature, right? Active control of all joint capsules.
Right. I mean, and that's going to make them stronger in the end. Again, you're preparing the joint, you're preparing the ligaments, you're preparing the body for something to happen.
Yeah, for sure. Yeah. And you want to prepare the body for load and also high contact when we're talking about mixed martial arts fighters, when they are producing force and they need a lot of my guys. And it's funny because I do get a misconception somehow that people think that there is not a lot of non-contact injuries in the sport of MMA, which doesn't make any sense to me at all, due to the fact that they are moving multi-directional, and a lot of those guys are very tight in certain areas and lack the mechanoreceptors to be in certain positions that they do get into. So my main goal when it comes down to it is to make sure that they are capable physically and have that neurological capacity, or not an inhibition, to move their body in all directions. So we do that through movement quality. And the great thing, like I said, having a physio like yourself, Christiana, I'm able to converse with you on different things. And for my guys, they see it now, how we work together as a team. And I think every great establishment and every great athlete needs to have a team around them. And with American Top Team, with my own team, as far as when it comes down to coaching staff, like I have Nick with the cognitive conditioning, I have my assistants, and now I'm bringing you in, just to have that with me, man. I think that that's something that the fighters really, really, they can take advantage of in a sense and really benefit from, for sure. Let's talk a little bit about Graston, because we did a video on it. I got a lot of questions on it. What's the mechanism behind it? What's the purpose, and what does it do, and why would you do it?
So I actually wanted to get certified in the Graston because of working with bodybuilders. And my thought process was, like everyone else's thought process is, it gets rid of scar tissue. Well, it's not the case. It can't get rid of it, right? You have to really, go in and have surgery and remove it. But guess what? Surgery recreates scar tissue too. So, but what the tools can do is realign the tissue. Yeah. So they're instruments. I shouldn't call them tools because Graston will find me. But they're metal instruments, okay? And they work along. Actually, what I love about them, first off, is what I want to say is that they're really diagnostic, meaning they're like a stethoscope, right? You can find adhesions under the surface of the tissue a lot quicker and a lot faster, and with a more define, a definitive of what it's feeling like than my hands can. Yeah. And that was the number one thing I loved about it, is I can run that tool across, paraspinal, and I'll find exactly where those trigger points are, those adhesions are, faster than I can with my hands. And then I know, okay, this is that area that's really uncomfortable. They'll be like, oh yeah, did you feel that? And it feels like a speed bump, and it feels grindy. It feels, just like sandpaper when you're moving it. So it works off of vibration, in essence. Right. And what that does is it does recreate the inflammation process, but you don't when you have a patient, first off, you want to introduce them to that tool too. And I see a lot out there, people go right in and start digging on these people and bruising them at the first point, and it's like, you can't do that, because you really recreate that whole injury back over again.
So just to let you know, I had no bruising after you did that grass in on my leg.
You really shouldn't have. I mean, some people that really are, prone to bruising or bruise easily, that's one of the questions, you want to ask them. Or, if they're on blood thinners or something like that, that's a contraindication. But, after the session, you might have some bruising. But during the session, you want to get to the point of seeing petechiae, or a little redness under the skin in the tissue. But you don't want to get them to the point of bruising right then and there. And what it does is it stimulates fibroblastic activity, which promotes healing. So it brings good cells, good healing cells to that injured area or that tissue. So let's say you have a tendonitis, elbow. Let's say you have an elbow tendonitis. You do it broad, and then you can go in with the tools. So there's instruments that are broader and wider, and then there's ones that are really smaller and specific. And then there's different strokes you want to go, depending on what ligamentous structure you're working on or whatever muscular tissue you're working on. And then there's different techniques. You can fillet the muscle, you can separate the muscles, or you can do like a cross friction across the tendon, like you can with your hands with, manual therapy. Or you can even do an ART type of deal, where I did that on Phil. You're pinning the muscle and he's actively contracting it, or putting it in the eccentric phase, and you're actually getting around that adhesion, like ART with your hands. So they're great. And I think the other thing that's great about them is if you have a neurological, let's say someone had compartment syndrome, and, the skin is really fresh from a graft, and they're not tolerable to, even the water or their skin on their shirt, you can actually go very lightly on it with the tool, and you can actually desensitize that. And so you can actually normalize sensation for them with those tools as well. So they're pretty magnificent. I really do love using them, and most of my patients love using them too. So that's one of the instruments and one of the certifications I got when I got out of school, because it tended to be a more popular thing on social media as I got out. But I actually started seeing the benefits of it. And something I had reached out to, I don't know if you guys know MI40 Gym in Tampa, but they do a lot of research out of there too. And I had contacted, I forgot his name now, Dr. Jacob Wilson over there. And, I was like, what about putting together some type of research study? Because they wanted to do, stem cell injections and learn a little bit about PRP and all that stuff. And I really wanted to see, well, what do you do if you can do that injection and do Graston right after it? And, I wanted to do a research study like that. So that's something I hope to get to do one day, and maybe bring out a little bit more research for Graston.
Are you looking for a PRP doctor for that?
Yeah, that would be my ultimate goal.
We'll talk after this.
Okay.
I got you.
Okay.
But you say now, I remember in passing you were talking about you really don't believe in stem, or not stem cell, but electrostem. What would you say? Anything wrong with that, or what do you think?
No, so it's not that I don't believe in it, because it's got its purpose, and I use it definitely. Let's say right after big injury, shoulder injury, decrease pain. Again, you can work on acute fibers for pain. You can work on chronic. But I don't just put the patient on there and I have them sit for 10, 15 minutes and I go and do something else, which is a lot of what you'll see in a regular outpatient clinic. Like, they'll put it on every single patient that walks through the door.
Yep. That's how they did me in college. They just put it on.
It's not always necessary. It's just, it serves its purpose for some things. Okay, after ACL surgery, right? You have VMO weakness. You want to do a Russian stem to start activating that quad. Neuromuscular reeducation, 100%. But do you want that patient depending on that machine? No. So I don't necessarily that I don't believe in it. I do believe in it because it does work. But I don't think that, I think the concept is people think they have to rely on these things. And the other thing I like to tell them, like I said previously, is that it's a modality. The table and that stuff is not going to get you back in fighting someone, you know what I mean, in a ring. It's not going to get you back to lifting 700 pounds on your back for a strongman competition. So it's how do we transition you from that to your sport? And then promoting longevity in it too. Yeah, longevity is not sticking you on a stim machine every day.
Recently, Dr. Mike Camp had Chris Weidman in, and he was doing this plane of movement with his shoulder with electro stim node hooked up to, I think it was his supraspinatus or his infraspinatus, and it was almost like he was using it in an ART form.
So that's a different type, and I actually looked into that because I really want to get that, but you know, when I get a little bit bigger, maybe I'll be able to get it. It's called the New Fit machine, and it actually just came out, and they're really, it looks like stim, but it works along finding hot spots in the body. So let's say you have a limitation in a certain motion, like, I don't know, shoulder flexion or whatever. It's going to find that hot spot that's limiting you, and you run it over. So you put the stim on the muscle, and then you run it over, and it's supposed to get rid of that hot spot or that blockage, not allowing you to do that motor pattern. And then it, you know, and then you'll see when he does it, he does the manual therapy, and then he does the treatment, and then he has to do the motion without the machine on him, and then he's able to do it.
Right, and then you'll see, like, you know, night and day difference in the range of motion after. Right. Okay.
Right.
Yeah, it makes
and that'd be
sense.
something I'd love to look into more, but I also should do my research a little bit more on that. I know it's fairly new, but he seems to be getting really good results from it, from what I see.
Sure.
So the only thing I would love to know is, like, how does it hold that up? You know, does that hold it up for a certain amount of time? Does it, you know, go after a day or something? Does the motor pattern come back? So that would be something that I should research a little bit more, look at what they have out there. But that machine, yeah, that's not just your general stim machine.
Right. It's pretty specific.
Yeah.
Well, we've been in touch with Dr. Mike this week, and hopefully next weekend we'll have him on the show. So perhaps you could send him a text or something like that and just give him a nudge, make sure he's available.
I will. I'll say it to him.
That's great. So what about some of the fighters that you two, Phil and Christiana, are working with together? I know we were talking about Will Brooks earlier, but are you working with the majority of the team, or is it just a select handful of the athletes? Like, what's going on?
So I've been actually working with a select few athletes, even outside of ATT. And then when I met Phil, I started working with Will religiously as he's getting ready for the fight October 13th.
PFL?
And now...
Yeah, PFL.
Yep. And then I've had a couple of the other athletes start to try and transition in these next couple of weeks. I want to say...
Caleb Williams.
Caleb. And Muhammad.
Yeah, King Mo Lawal is also another one that we're going to bring to her too as well.
So, and I think Euros too.
Right. Good regional guys, good up and comers. Also going to get Jordan Young in there. He's an up and coming Bellator, undefeated prospect. He's one of probably the best prospect we have in the gym right now. Kid's got high hopes, but he's definitely has some things that we need to fix as far as his hips go, because he's a long, lengthy guy. He has some imbalances, has some compensation there just from striking and being in that fixed position, like Christiana said. You develop those imbalances, those asymmetries, so we want to try to correct that right now because he is only 22 years old. So that's somebody I will be bringing over to you, just so you know by now. I mean, I'm just saying.
And I love it.
And then, of course, you've got King Mo, who's been in the sport forever, and no doubt he's going to have some fun injuries for you to play with.
Oh yeah, they all do. It's great when I go there and they come on and I'm like, what's going on? And it's like this.
Yeah, people really,
I love it.
People really don't know what these guys actually go through on a daily basis and how they train and train hard with all their injuries that they have. And the biggest fighters that are probably all these listeners' favorite fighter, they probably don't know the injuries to the extent of what they have, and seeing them watch them fight, and they wouldn't even know that they had those injuries. So it's funny, but you know, that is what it is. What it is. We work around it as much as we can, and then we bring people like yourself, Christiana, to bring them in and to help them out so that we can progress in our performance and overall longevity in the sport.
Right. It helps them with their own body awareness too. You know, for instance, I was working with a fighter who, you know, he's been dealing with a chronic right knee issue, and he's done everything. And I looked at him and I was like, so you've done acupuncture, he's done massage, he's done this, he's done that. I'm listening to him, and I'm looking at him, I have him stand, and he is so flat foot. And I'm like, I want to see you kick. Let me see you kick the bag. So he goes and he kicks the bag hard. And I just watch his whole foot collapse down, and he puts all that pressure into the medial aspect of his knee. Yeah. And I'm like, we need to re-strengthen the bottom of your feet. And he was like, what? And I was like, we need to strengthen the bottom of your feet. I was like, because what you're doing is every time that you're on one leg, you're putting all that pressure into the medial aspect of your knee, and you're creating that pain. And as soon as I started retraining him to kind of get on the outer aspect of his foot, but still be able to grind his big toe down, he wasn't having that pain in his knee. Now, it took some time to get there, because it's not easy for a lot of them to be aware of the bottom of their feet. Yeah. And, you know, just, again, being able to look at that and micromanage that for them is important, because they're like, he's like, well, no one's told me that. You know, I've been through this for like 3-4 months already, and no one's brought that up to me. You know, why is that? And it's like, I don't know. I don't know.
It's important that's why assessing the athlete every day is vital, right? And if you're a preparation coach, if you are a physician, clinician, or wherever, you need to make sure that you're physically assessing the athlete on a constant daily basis. Otherwise, some things are going to slip through the cracks. I mean, I have 80+ fighters, literally 80+ fighters that are in camp right now. But I have 3 to 4 eyes on all the guys each and every day when we do our base support system, as we work from the feet all the way up into the shoulders, you know, and utilizing those my guys and yourself too, Christiana, now. But you know, that's one key aspect of progression and overall reducing the risk of injury, to understand the athlete each and every day. And one thing may show up on one day and may not show up on the next day, and vice versa, and you got to constantly be assessing them each and every day. So.
And that's what's been great with Will, is that, you know, I know that Phil's done such a great job with him already, that Will is really in tune with his body, as much as he likes to say he's not, but he is. And, you know, me educating him on some things I want him to throw in his day-to-day stuff, even when he's not with Phil, is great. And because of that, you know, Phil will be like, oh, what's going on? And we get to converse on that. And then there you have it. There's 2 intelligent people on your team that are agreeing on something and telling you that you need to be doing this. You know, it's not just one person, like, you know, he's with Phil, he's joking around, and he's like, whatever. And I'm like, no, you really need to do this. Like, he's not wrong. You need to work on this. And you know, and it's amazing. But I also got to, you know, when I got to actually work with Will one-on-one, learn more. And he even was like, oh, I have this thing with this, and I have this, and I have that. And I'm like, all right, well, let's work on it. Like, let's deal with it. And he was amazed by just doing a few of the things I was telling him to, as simple, as silly as they were. He was like, I didn't feel it this week. And I even asked him about it. He's like, you know what? I didn't even think about it this week to even tell you. So it's pretty, you know, it's pretty awesome when you can have a stacked team like that too.
Now, Christiana, from a fighter's perspective, because we do have a lot of fighters that do listen to this, and coaches in general, you know, what should be the steps to, you know, going about rehabbing any type of injury? First and foremost, is it, you know, doing the standard icing and going to get an MRI, or should they go see a physician first, or what's the steps that they need to take? And you're talking directly to fighters right now, so, you know, make sure that you understand that, and just go ahead and do your thing.
Okay. Specifically with any injury, you want to do, obviously, your RICE, rest, ice, compression, elevation. First 48, 72 hours. If it doesn't get better with that, I would say go, if it feels like it's off the bone and you'll know it's off the bone or it's not in place, go get an MRI. But if it's something that's like been a repetitive issue, kind of keeps going over time, that's something I'd rather you go to a physician for, or someone that really can assess you and know what it is going on, because probably it's some type of movement pattern that you're doing over and over and over again that you kind of need to get looked at and be like, all right, well, this is going wrong or this is going wrong, and go this way. The problem with, it's not saying that I don't think you should go get an MRI. What I think, obviously when it's an acute injury and it happens right then and there, and obviously there's something traumatic going on, yes, go get it. But with fighters too, they have strong pain tolerances, right? So sometimes those guys might just go through a dislocated shoulder and not even look into it.
I'll be honest, and I don't mean to cut you off. That's about 98%. And the young guys in general, they won't tell you shit. Like right. the older guys are pretty smart. They know their body and they know that they need to preserve it and they need to have longevity. So they will say something, but a lot of them, and I was one of them too. I didn't say shit. I got a fractured foot right now. That's from kicking, and I didn't do shit about it. I just kept working on it. I kept kicking on it, matter of fact, until I can't. Now I have less dorsiflexion on one side, fucks up my hip. Now my shoulder hurts. It's chain effect. But right. Go ahead, my bag.
Lo and behold, if they were to either go first and get an MRI or go to a physician that they trust and they know is pretty good, the physician is smart enough and should be smart enough to test those ligaments or test that or do a special test to say, you need to go get an MRI and we need to confirm this before we go any further. Mm-hmm. The problem I think with MRIs though sometimes is that people define themselves by it. Mm-hmm. I don't know how many times I've had people come in and be like, I have degenerative disc disease, and I'm like, I bet you do.
So what?
It's like everyone has it, but they define themselves by it, and then they're like, well, I'm not going to do this, I'm not going to do that, and because they define it by that MRI, so sometimes it depends on the person, and that's where I was talking about that biopsychosocial model, which I like to use, and the clients don't necessarily know I'm using it when I'm evaluating them, but getting them talking a little bit about their situation and their life and stuff like that, because you can tell by what they have going on outside of that fight world, mm-hmm. what they're attributing towards that pain.
Is it going from the brain into pain factors of the body? Is that what we're trying to get at right now?
So you look at factors like if they bring up that they're going through a custody battle, or they're going through, they've had issues with suicidal thoughts in the past, or they've had issues with drugs and alcohol in the past, or ADHD or bipolar or schizophrenia, any of those things, you're looking at that as a flag. So if they're coming in and they're having issues with really chronic pain, and there's someone that says, well, yeah, I was diagnosed with DDD 10 years ago, and they don't want to do certain motions or certain movements because they think that it's going to inhibit them or prevent them from doing what it is they're doing, you kind of have to really work with that patient or that client a little bit closer, mm-hmm. because now you got a lot of psychological factors going in. Mm-hmm. Sure. And a lot of fighters, and I'm not saying every single one, have had a rough history. They've had a rough past. They've had some psychological issues going on. And I'm realizing that now as I work into it, like how they, one day can be really good for them and one day can be really bad for them. And that plays around with that. Go ahead.
Yeah. So I don't mean to cut you off. I'm sorry.
No, you're fine.
But I just, cause at this point right now, like you're getting into really deep detail of what fighters are, and in general, it takes a certain type of individual to get in the cage and actually do what we do, Yeah. And if you're not that type of person, you wouldn't understand it. You couldn't even live in the world that we live in. I train general public on, at some points, and then I live in a world that I live in at American Top Team, and it's two totally different worlds. It's funny even to watch because it's just so different, and people just don't get it. But these individuals beat themselves up on a constant basis, going in there and going to war in the gym, and then going and fighting in front of millions of fans, and having so much riding on this one particular fight that, yes, stress and overall just fatigue from that, and then having these problems with their body because of it, it does play a role. And that's why it's good to have that connection when it comes down to a clinician too as well.
Right. And that's why, you know, if I do, and I, like, again, you know me, I'm a very personal person, and a lot of people do open up to me, and a lot of what I tie in when I teach them exercises or I teach them things at the end of the session, it's, you know, really about self-love too. Like you're when you come to me, you are making an investment. You're making an investment. So when I tell you to do certain things because I want you to be the best at your sport, you know, that's self-love. I'm trying to teach you self-love. I'm not going to misguide you. I'm not going to, you know, guide you in the wrong direction, because that's not me and that's not who I am. And people will get that from the first time they meet me. And
true.
That's something that I, you know, no, I'm not a psychologist, but we play such a big role on that forefront with them that sometimes we are the only people that they open up to. When you put your hands on someone and you work on them, sometimes that tends to open up emotions and they want to tell you more, you know, personal things. And you're like, now it makes sense. And now you tie those things in, and now you try to get them out of that and be like, okay, I see that and I understand that and I hear you. But look at what, you know, and then you got to get them to look and how this plays a part in what it is they have going on, and how you want to try and guide them to take what it is you're learning physically and what they're doing. Like you said, Phil, they're fighting at practice, they're fighting at work, they're fighting at home, they're constantly fighting in a battle, and you're trying to teach them self-love. And that's why I said when I first started at that job dealing with addicts in recovery, it transitioned me really well into working with these fighters, because those people at that time, all they need at that time is self-love or love or a connection. So if you can be a connection and guide them in a right way and be like, look, I'm sure you've had a doctor in your life that's misguided you. I'm sure you've had a doctor in your life that hasn't treated you right. But I'm here and I'm going to show you some sort of way, whether that's longevity in your sport, whether that's getting over a meniscal injury, or, you know, a stubbed toe. I don't know, you know? So
Christiana,
that's why I think my job's important with that. Go ahead.
I'm sorry to jump in, but I have a question regarding this stuff. I love how you're framing the treatment and the therapy within a context of self-care and self-love. My question is, we know that the autonomic nervous system can't really differentiate between stresses, be them, you know, social, physical, nutrition, sleep, training, whatever. Like, how are some of the ways that you're seeing this biosocial, cultural, model that you're talking about? How are some of the ways that those things are manifesting in the people that you're observing?
So it was funny, when I did one of my rotations in NYU in the city, I did an outpatient setting with chronic injuries. So it was only chronic neck or chronic back pain. People have been dealing with stuff over a year, you know, 10 years, 14 years. Could be fighters. It could be your regular, you know, Wall Street guys, you name it. And I worked alongside a cognitive behavioral therapist. So the person would go to therapy for an hour with the therapist, and then they would come to me. And again, they're dealing with like high levels of trauma psychologically. And we'd come together, the therapist and I would come together and talk about a plan of care for them. Sometimes you can give a certain person a bunch of exercises, you know, let's say treatment protocol, and you can give them like all of it, all the instructions, whatever, and they'll do it. They'll go and do it. Sometimes with some people who are, you know, all over the place, or sometimes too much is, you know, you get that feeling from someone when you really actually learn psychologically what their brain's like. And if you feed in all these different angles and all these different exercises, or like an exercise that's got 4 different patterns, they're going to be like, I'm not doing this. You know, this is way too much to attain to my task. So some people you can be really logistic with. You can be like, okay, you know, bring your toes towards you on a straight leg raise and squeeze your quad and bring it up. Sometimes it's like, just lift your leg. Just lift your leg. Make it plain and simple. Because when you start getting like that too much for them, they start getting anxiety too.
Yeah.
And you start really tying, you know, your protocol in. Like some guys, I can do that. I can do a lot of high level stuff. Some guys, I got to be really basic to the point.
Yeah.
Because sometimes when you overload that brain and you overload that nervous system, they're like, nah, no way.
Not happening.
When they shut down. And a lot of what that PRI stuff I was talking to you about, that postural restoration stuff, I've been kind of adding it in, and a lot of it more so towards the end of their workouts or after, you know, high stress level stuff, where they're actually working on that rib mobility and the diaphragmatic breathing, because that diaphragm nerve runs to the anxiety center in your brain, right? C3, C4, C5 runs to the anxiety center in your brain. So if you can control your diaphragm, you can shut that sympathetic nervous system off, your fight or flight mode, and you can promote parasympathetic nervous system to turn on and have them just chill out. So a lot of the times I'm teaching them some of this stuff, you know, mainly for a posterior pelvic tilt and an adductor squeeze or whatever, but I'm also implementing it because I know that if I do this at night before bed, they're going to shut their brain off.
Yep.
But I know that athlete's got a lot going on.
Yeah, we do that for post exercise, post training, as I'll have them diaphragmatic breathing patterns for about 3 to 6 minutes, and some of them will go to sleep.
Yeah.
Right after they get a hard training session done. So I mean, it definitely does work for sure.
Yeah.
It's interesting, that link between the diaphragmatic nerve and the anxiety center you were talking about in the brain. It kind of controlling the breathing diaphragmatically reminds me of what Hickson Gracie said. He said, "Control your breath, control your life."
Yeah.
It's true. It's so true though.
Yeah,
and like you don't think about it, but like you think about when someone would like, back in the day get really anxious or whatever, and they'll hand you a paper bag, right? Yeah. And that's to control that, it's to control your breathing, and that's to control the anxiety center in your brain.
Here, hyperventilate.
Yes. Well, you want to try them to slow it down, but.
No, that's fantastic.
But yeah, same concept.
So, what else have we got on the agenda today, you two?
Well, as of right now, I want to get Christiana's overall future plans and what she wants to accomplish, and then from there, obviously go into her social media and where she could get followed and things like that. But I don't want to give too much away because we have plenty more to do. But for now, what's your future plans, Christiana, and where you feel like you can contribute, I guess, to the MMA world right now?
So my future goal is I would love to be able to show athletes how physical therapy and taking care of themselves from a rehab standpoint can actually benefit them and keep longevity in the sport. You don't want to hear fighters that are, in their early 30s being like, yeah, well, I'm too old, I'm too beat up for this. And it's like, no, you got time. You have time. And there's no reason you shouldn't. So I want to be able to eventually, obviously, work on every fighter in the world and cure everyone. But I'd love to be able to get on some, and this is absolutely amazing. Again, I really am grateful for you guys having me on here, but
no problem.
To get on some sort of social media to say, to, promote good therapy, because I think so many people, and not just your fighters, but so many athletes too, are like, I'm not doing physical therapy because I've been in that setting where it's, you're 4 or 5 patients in an hour, let's say it's a knee injury. They just focus on the knee. They're not looking at your hip. They're not looking at your ankle. They're not looking at how your shoulder can attract to it, because you don't have the time as that clinician. They force you to, that's it. 5 minutes with the patient's hands on. That's it.
Yeah. And
you send them to a tech, and it makes me cringe. So a lot of what I try to promote is when people are like, oh, your prices, and it's like, but I'm spending an hour and a half. Yeah. And you're not getting that one-on-one time where you can somewhere else. So what I hope to show people is that there is this side of the therapy world, especially fighters, that there are clinicians that are so good, that know what it is they're doing, that understand their movement patterns, that understand that you need to put food on the table at home, that understand that you have all this X, Y, and Z going on in your brain, but guess what? I'm still going to help you get to what it is you need to get done. And I'd love to get, doing stuff like you do, Phil, like seminars and stuff like that. I don't know how I would tailor it towards anything yet, but
Nah, we'll make it work. We'll make it work. I got some plans. Don't worry.
All right.
Whenever you're ready to come to Australia, just let me know. I'll set it up.
Oh, I'm there. I've never been there.
Awesome. You're going to love it.
I can't wait.
All right. So go ahead and, Christiana, go ahead, tell them your social, all of the Instagram, Twitter, Facebook, all of that stuff so that they can connect with you, if they feel so.
Absolutely. So my Instagram and my IG is just DR, and then my full name, Christiana Marron. And my Facebook page is just my name too, but I have a business account, which is Dr. Christiana Marron, plain and simple. My Snapchat is the same, just Christiana Marron, my name. And my Twitter is, Dr. C. Marron.
Cool. I think you should change every one of those to Dr. C. Marron, just to let you know. But we've talked about this. I think I'm going to come up with a cool nickname for her, though. We'll see what's up. You know how I do.
C Money.
yeah, C Money.
Dr. C Money. I know, my name is very long.
It's all good. Listen, I appreciate you coming on. You know that I hold you in high regard. You are one of the up and comers, I'm gonna say right now. So I wanna make sure that people understand who you are and what you got going on, and see you in the future. Especially, we might be throwing you in there with FSI and what we got going on. Even Dr. Mike Camp, obviously talked highly about you too as well. So we're good. We're good with that. We're all big family over here.
Yeah.
And so we're happy to have you. Mac, you want to let them know your social, let them know the podcast social. We'll get up out of here.
Absolutely. Okay, so you can follow me on Instagram @unknownstrength. And the podcast, well, we pretty much promote this podcast through the Fight Science Institute Instagram page and Facebook pages, so check them both out, Fight Science Institute. And I guess lastly, I just wanted to say a massive thank you to you, Christiana, for joining us and for sharing your story. What an inspiring, what an incredible story you've had so far. It's really, really exciting to have you on.
Thank you, Mac. I really, truly appreciate it.
No, the pleasure's ours. All right, well, why don't we call it a day? We'll wrap things up, and please stay on the line after.
You got it.
All right, thanks, everybody. Thanks, Phil.
Thanks.